Good morning, everybody. Thank you for joining us this morning. If you're just joining us, we're going to wait maybe 3 more minutes. That way others can also join us. And then we'll begin the morning scoop today at 8:01 in the morning. Yeah, I remember when Amanda was in the state legislature and
Good things were happening, huh?
good things were happening.
At
Yes.
at least we can work a little bit bipartisan, so that was a good thing. I was able to pass my legislation with a very strong bipartisan way, so support.
Yeah, I remember the stakeholder meetings you used to hold.
Yep.
Um, it also helped that at least in your case, it helped that you had a Democratic governor at that point.
Yes, and then we have Governor Brewer as well, so
Right.
um, we had a lot of good meetings on mental health and trying to integrate the system, healthcare and mental health. So
Again, good morning, everybody. Thank you for joining us. If you're just coming on board, welcome. We're going to wait maybe a couple more, maybe 2 more minutes, something like that, so we can allow others to join us as well, and then we'll start the morning school.
Luigi, what's your average attendance for the morning scoop?
It would depend. It can be anywhere between 150 people to as many as when we were having debates last year, election debates. 700 people, depending on which debate we would have. So we had a debate on Prop 208, and that was probably our biggest attendance. As you can imagine, there was a lot of interest, and so. Yeah, and then typically also if we have at the beginning of the year when we'll have the legislative leaders and they'll give us a bit of a preview about what's already happening, we'll have good attendance as well. So it depends on the subject, and obviously it also depends to a certain extent on what else is happening. I think it's 8:01 in the morning. I think we're going to start. Again, good morning, everybody. Thank you for joining us this morning. My name is Luigi Del Puerto. I'm the publisher and editor of the Arizona Capital Times. The Arizona Capital Times, of course, covers state government and state politics. And if you don't have a subscription, you let me know. I'll get you squared away. We have a big subject this morning. The Center for the Future of Arizona's 2020 Gallup Survey, Arizona, which was released a couple weeks ago, highlighted broad agreements among Arizonans on the kind of healthcare system that they seek, that they want. That means affordable insurance, accessible mental health services, substance abuse programs, quality care that doesn't risk financial harm, telemedicine coverage, and of course, expansion of the Arizona healthcare cost containment system, which is our state Medicaid system. We will talk about some of the results of the survey, and of course, the challenge of expanding healthcare access in our state. We are very fortunate that we can hold this discussion this morning, and the reason for that is we have a sponsor, and the sponsor for this morning scoop is the Center for the Future of Arizona. The center is a nonprofit, nonpartisan organization that brings Arizonans together to create a stronger and brighter future for our state by advancing the priorities Arizonans say matter to them most. One of those top priorities, of course, is having access to quality and affordable healthcare. And CFA, the center, hopes that this morning's conversation will prompt the state's leaders, policymakers, and cross-sector experts to inform policy, practice, and investments to drive the changes that Arizonans want to see. And at this point, please allow me to introduce Dr. Sybil Francis. Dr. Francis, founding member and president and CEO of the Center for the Future of Arizona. She brings her passion for creating positive change, her love of our state, and her considerable prior national public policy experience to her leadership at the center. Prior to being named president and CEO, she served as executive director of CFA from 2002 to 2018, during which time she spearheaded key initiatives in education, workforce, and civic engagement, and grew the organization's impact and programs. Dr. Francis, welcome, and please share with us more about what the Center for the Future of Arizona is and what it does.
Thank you so much, Luigi. It's such a pleasure to be here with you this morning with the Mornings Group. And I just want to say you provide such a great service to all of us in Arizona by bringing important and timely topics to the table for discussion. So congratulations to you for all that you do for Arizona. And we're of course very pleased to sponsor this event and others that we've done in the past, because we are committed, as you are, to shedding light on important issues and also in catalyzing action through data-based discussion, decision-making, and action. As you mentioned, our mission is to bring Arizonans together to create a stronger and brighter future for our state. And we do that in multiple ways. First, we listen to Arizonans and what matters most to them. And this very much relates to the Gallup survey that you mentioned. We share trusted data and information about how we're doing as a state. We identify important challenges through our listening to Arizonans and also opportunities that need to be addressed for our state. And finally, we work with communities and leaders to help them identify issues that matter to them and to help them solve the challenges and rise to the issues that they want to solve. So one of the ways in which we help spotlight and share information is through venues like this in partnership with you and the Morning Scoop. And really our hope is to stimulate discussion and foster greater understanding and insights and action into important issues that impact Arizona. As you mentioned, the Center for the Future of Arizona recently released the results of our second decennial Gallup Arizona Survey that asked Arizonans what they thought were the most important issues for Arizona's future. We conducted the first of its kind statewide survey of Arizonans in 2009. And in 2020, we again asked Arizonans to share their views on the big issues and questions that will be important to Arizona's future, including in the area of education, jobs, healthcare, natural resources and environment, infrastructure, young talent, and civic engagement. You can see the results of the survey, or even take the survey yourself if you're interested, on our website at www.arizonafuture.org. So of course, the quality and cost of healthcare was among the top issues. In fact, it was the #1 issue ranked by Arizonans as important to them and their future, as ranked against other issues. So this morning's discussion is really timely and important. And I just want to say thank you again to you, Luigi, and to the panelists for participating in this morning's discussion. And I look forward to the conversation. So with that, I'll turn it over to you and the panelists.
Thank you, Dr. Francis. I appreciate the very kind words. We have a great panel this morning. Joining us this morning is former Arizona State Senator Amanda Geary, who serves as president and CEO of the Regional Center for Border Health, a position she's held since 1991. She also leads its subsidiary, the San Luis Walk-in Clinic, which is a primary care rural health medical center. Former Senator Amanda Geary has been involved for more than 35 years in healthcare and business administration. In 2007, she established a licensed post-secondary vocational training center in the area, the RCBH College of Health Careers, which has generated job opportunities for more than 1,800 individuals. She has built these corporations that have become multi-million-dollar corporations, providing employment for more than 300 employees in a slow recovering economy. And of course, in 2003, she became the first female and the first Hispanic to represent District 24, which now encompasses Legislative District 4 in the Arizona House of Representatives and in the Arizona State Senate, which she served through 2010. And from 2000 and 2003, she also served as a member of the U.S.-Mexico Border Health Commission, appointed by President Clinton. Amanda, thank you for joining us this morning.
Thank you, Luigi, for the invitation. It's very glad to be here with all of you. Thank you.
Thank you. And also joining us this morning is Carmen Herrera, who is the Chief Executive Officer of Valle del Sol, a nonprofit organization organized and originally founded in 1970 to provide advocacy, mental health, and leadership training to Latino communities in the Phoenix area. Today, Valle del Sol provides integrated behavioral health and primary care health to underserved populations through 8 locations in Maricopa County. Ms. Heredia is currently serving as the chairwoman of the Community Board of Dignity Health, St. Joseph's Hospital and Medical Center, and Westgate Hospitals, and on the boards of the Center for the Future of Arizona, the Arizona Council of Human Services Providers, the Arizona Alliance of Community Health Centers, the National Council of Behavioral Health, and the Advisory Council of the Phoenix Community Development and Investment Corporation. She's a member of the Greater Phoenix Leadership as well. A leader in her community and organization, Carmen strives for equality and inclusion of underserved populations, especially regarding access to quality healthcare and education. As a Mexican immigrant, she passionately volunteers in Latino civic engagement, various political campaigns, and voting efforts with her family. She lives in Mesa, Arizona with her husband and 3 children. Carmen, thank you for joining us this morning.
Thank you. Good morning, Luigi. Thanks for the invitation.
Also joining us this morning is Mike Patterson, who is the Chief Executive Officer at Havasu Regional Medical Center, a position he's held since September 1, 2014. He's also the Market President over Northwest AZ for LifePoint Health since 2018. CEO of the Havasu Regional Medical Center, Mike is responsible for the overall leadership and direction of quality physician relations and recruiting, patient satisfaction, and hospital strategies. And in addition, his market president's responsibilities include oversight of the Valley View Medical Center in Fort Mojave, Arizona. Prior to coming to Lake Havasu, Mike was the chief executive officer at Colorado Plains Medical Center in Fort Morgan, Colorado. He has also worked in 2 other LifePoint hospitals in Wyoming. He earned his bachelor's of accounting at the University of Utah and also his master's in business administration, also from Utah State University. He is a fellow of the American College of Health Executives. He is very active in the community and has been a member of the Rotary since 2006. He serves on the Arizona Hospital and Healthcare Association Board, the American Hospital Association Region 8 Policy Board, and as well as the Partnership for Economic Development Board in Lake Havasu City. Mike, thank you for joining us this morning.
Thank you, Luigi. Glad to be here and appreciate the invitation.
And finally, joining us this morning is Representative Amish Shah, who represents LD24, a child of immigrants. Representative Shah attended Northwestern University in Evanston and graduated cum laude with a Bachelor's of Arts in Economics. He then graduated from Northwestern University Medical School as part of the honors program in medical education. And after medical school, he worked for an international strategy consulting firm. He completed a master's in public health with a full merit scholarship at the University of California, Berkeley, followed by residency training in emergency medicine at New York City's busiest level 1 trauma center. He won the American Academy of Emergency Medicine's National Resident Research Competition for his work in inventing a new method to provide care for the critically ill. He also taught medical students and residents at the Mount Sinai Medical Center in New York as a full-time faculty member and academic researcher. And amidst concerns over the potential catastrophic injuries, he helped the NFL improve their emergency management through research and presented his work at the NFL Physicians Society. He graduated from the University of Arizona Sports Medicine Fellowship, and outside of his medical practice, he founded the first Arizona Vegetarian Food Festival as a philanthropic endeavor to promote healthy eating and eliminate preventable diseases. Dr. Shah, thank you for joining us this morning.
Thank you so much for having me.
I think I'm going to kick off our discussion by asking Representative Shah about what happened in the state legislature yesterday. As you know, the House leadership tried to pass a state budget, and so we'll get an update from Representative Shah on that.
Yeah, very briefly, we were told that the House would be gaveling back in. We were initially told a couple of weeks before that it was going to be June 10th, but they wanted to try to push the budget through. There was a contentious proposal with regard to the taxes. Those measures, the bills that they tried to put forward failed. We voted on 2 bills, if I'm not mistaken, and those have failed. And so I think this is going to be back to the drawing board, or they're going to have to try to work something out in order to get the votes that are necessary to move this forward.
So the plan is still to reconvene on June 10th. And we just don't know if at that point there is enough support for a budget proposal, correct?
Well, I'm understanding that we are being called back for Thursday, and so we'll see what happens. I don't know much else about the discussions at this point.
One final question before we move on. Any sense as to when the legislative session might end this year?
I don't know. There's a sine die pool down there, and if you knew the answer to that, you win a prize. So no, but unfortunately I don't.
I can tell you that I already lost that pool. So, I do remember when we were here, when the session lasted for, pretty much throughout the year. And that was when Amanda Geary was in the state legislature. But I've been carefully monitoring the COVID-19 cases in the country. I'm sorry, in the country and in the state as well. And the cases have gone down. The mortality rates have gone down. Infection rates are down as well. And I think a big part of that is the vaccination rate in the state has also been increasing. But I want to get a sense as to what you're seeing on the ground. I'm going to start with Amanda. Amanda, what are you seeing in your sector?
Thank you, Luigi. And COVID-19 pandemic has just devastated all our economy, our infrastructure that we have worked so hard, what I call the safety net for our communities in terms of accessing healthcare and accessing all kinds of services, as we have been working very hard and sustaining and addressing all the social determinants that we have been working in with several stakeholders in our community and statewide to maintain that level of wellness in our communities, and particularly in rural areas, as my work in my rural health clinics focus on Yuma, La Paz, and Mojave counties. And so what we're seeing is a high number of patients with more chronic illnesses totally out of control, and we're trying to manage those cases. The continuity of care was lost during that time. As much as we try to work on telephonically visits, telemedicine visits, which will help tremendously, having the state allow us to do that and being paid for those services, that really made a difference for all of us in rural areas where accessibility is a challenge. And so I think that we continue looking at how do we bring back those services to all the community need. What we're seeing more is more mental health, more substance abuse. The opioid crisis has never slowed down. On the contrary, became more exacerbated in many rural areas. And of course, the accessibility to care, when many clinics and services for the outpatient surgery centers, the mammogram clinics, they all closed down. So now we have to catch up with a lot of those preventive medical services.
Thank you for that update, Amanda. Carmen, what about in your healthcare system?
Very similar, I would say, when it comes to COVID directly diagnosing and treating. We've seen with the availability in the community to be able to get testing and vaccines, a decreasing utilization there. Recently, our health center started doing vaccines for children, and so that has been a new endeavor for us and an increased interest when it comes to COVID itself. Since we treat the whole person at Vital Soul, primary care and behavioral health, a lot of the increased referrals that Amanda was speaking to has been really in the area of behavioral health. A lot of depression, a lot of anxiety, a lot of substance use. We've seen the rates of domestic violence and abuse go up during the pandemic. Everything's just been really exacerbated. And she touched on, social determinants of health, and we'll talk about that later, just trying to treat the whole person and aspects that go beyond their direct health care, but the things around them that affect their wellness.
What I'm hearing is that we suspended, or a lot of people postponed the kinds of healthcare that they would normally have as a result of the pandemic. And now that the floodgates are kind of open, then we are seeing a rush of these, healthcare that we haven't done. And now we're having to go and ramp up the services that we have ramped down during the pandemic. Is that a fair assumption of what's going on?
That's exactly right. I think that's what we're all seeing probably in both the hospital systems and in community health centers. And then this is on the provider side, exceptionally difficult to do with the workforce we're facing. And that workforce shortage seems to be talked about in the restaurant industry and in different sectors, but in healthcare, it's just, there's a lot of burnout happening, and it's getting more and more competitive to really retain and recruit staff.
And Luigi, if I may, a lot of the challenges that we face in the healthcare system and in our rural communities that we offer these integrated healthcare services was when we faced the pandemic, was all the challenges that many of other clinics face is the lack of PPE, the lack of the testing kits. You remember the long time of the labs results coming back to the people that were testing massively. Certainly in our centers here in San Luis Walk-in Clinic at Regional Center, we have tested year to date more than 115,000 people throughout Yuma, La Paz counties, and now with the vaccinations, as Carmen mentioned, as we tap it off, we also have, I felt, kind of limited in terms of the accessibility of vaccines at the right time. And here we are in June with incredible accessibility to vaccines, but yet now we're facing the hesitation of folks getting the vaccine. So you get a double whammy when you're looking at healthcare system, and also for those of us that work in the preventive medicine world, having to now work harder to convince those that haven't been vaccinated to come and get vaccinated. We're proud to have 40% of the people vaccinated in Arizona, but what happened to the 60% that haven't been vaccinated? So in particular children, as you know, nationwide, 25% of the children that are ending in the hospital because of COVID. So that is something that we need to be worried about and promote a vaccination to the state of Arizona.
Thank you. And Mike, what are you seeing in your hospital system, sir?
Yeah, so in Mojave County, we are seeing the decrease in hospitalizations. We peaked out in January at the Havasu Regional Medical Center with about 70 patients in house that were COVID positive. Today we have 3, so it's a welcome relief. And interesting enough, talking about the vaccinations, the patients that are being hospitalized now chose not to be vaccinated or just didn't take that opportunity. So, we are not seeing people who have been vaccinated being hospitalized right now. So that's a good thing and a testament to getting vaccinated as well. But we are seeing the same things as Carmen mentioned with some burnout of staff and trying to recruit and backfill, some of the staffing needs that we have here. That's probably one of our bigger challenges at this point.
And finally, Representative Shah, you work in the emergency room. I think last time you were in our morning scoop, we talked about how things are at in the emergency rooms, but if you can update us as well, what you're seeing on the ground.
Yeah, it's pretty much a continuation of what we talked about last time and what the folks here have talked about. We are seeing volumes increase overall. So patients are returning to the healthcare system. And at the same time, we're not seeing very many COVID patients. I have seen a few, once every couple of weeks or so. And then, the question does come up, did you get vaccinated or do you want to? And, almost all of them, not everybody, but almost all of them have said that they did not get vaccinated. And some of those cases were serious, and a few of those people had really bad outcomes, including deaths. So that's why I encourage people to get vaccinated.
And I think part of the reason too that we're seeing not as many complications. Well, I shouldn't say not as many complications, but the death rates are down is because our doctors and our staffers and our nurses, they just over the months they figured out how to deal with COVID-19 patients. So we have a better protocol in place. Is that a fair statement, Dr. Shah?
Yeah, we did improve. My understanding of the medical literature from the start of the pandemic to the end of it was that we did get better at dealing with it. So with whatever tools we had in our armamentarium, whether that's some of the drugs, we had remdesivir, we had dexamethasone, and ventilator strategies like proning. I mean, these things came out in the literature, and I think physicians we learned, we adapted, and we figured out how to lower the mortality rate overall from the virus. It's still, as you know, a pretty deadly virus, but yeah, we did make a lot of improvements. That, and I'm talking about the rate there, not just the absolute numbers. The absolute numbers are way down.
Yeah, and it's very comforting to see the absolute numbers go down, but also the rates, both for infections as well as mortality, go down. What I'm hearing is that we've just gotten better at dealing with this virus, and the people that you're seeing end up in the in more dire situations in hospitals at this point for people who have not been vaccinated.
And Louis, we made one of the things that we want to prevent as we keep working on COVID-19 cases in the state. What we're seeing is the variants of COVID-19, the virus mutating, and and facing the possibility of what Europe have gone through, where they opened doors, they went back to normality, and then they have to shut down again. I think the difference between us and the European countries is that we have more vaccines available than they had at the time when they curbed down COVID-19, just purely because of the quarantine that worked in those countries, Germany, France, England, Italy, and so on. But I think that my fear is that if we're not getting enough people vaccinated, that we could go back to another COVID-19 wave again because of the variants. They can be more infectious and attack the body harder than just the normal COVID-19, which is still very lethal. But as we all saw, the number of deaths in the country reaching to 600,000 people. So we're still dealing with something very difficult and very dangerous. And our hope is that people will come to consensus and agreement that vaccines is what take us back to normal. Vaccines is want to sustain the economy that we want to reach back to normal. And we want to be able to open all the businesses and not go back to see a European situation where we go back to shutdowns. So I hope people understand that the economy depends on those that starting to get vaccinated and prevent the spread of COVID-19.
Thank you for that. And to our viewers and to our listeners, I do encourage you to send in your questions. We'll focus the second half of this discussion on expanding healthcare, but don't hesitate to type up your questions via the chat box or the Q&A box, and we'll try to get to as many of them as we can toward the end of the program. I want to share a couple slides here from the Center for the Future of Arizona's 2020 Gallup survey. What really struck me about this survey is that there's a lot of agreement, kind of universal, a consensus on the kinds of healthcare that we want. For example, 83% of Arizonans in this survey say it is important to ensure any Arizonan can get quality healthcare without the risk of financial harm. The percent of people satisfied with the healthcare that they're getting is 60%. 40% are satisfied with the wait times, 38% are satisfied with the healthcare costs, and 35% are satisfied with the availability of mental health care providers in their community, which means if you think about the reverse of this one, 40% of people are really not satisfied with the kind of healthcare that they have, especially higher in the dissatisfaction rates are especially higher in certain areas, in certain vulnerable populations, both in terms of, in terms of geography, for example. Native Americans, not satisfied with the availability of healthcare specialists in their communities. Hispanic Arizonans, not satisfied with the healthcare costs. People in Western Arizona, not satisfied with the availability of mental health care providers in their community. And of course, residents of Maricopa County are just not satisfied with the cost of prescription medication. This final slide I want to show to you kind of breaks down the how important it is for Arizonans with regards to healthcare changes over the last 10 years. And you can see that, of course, healthcare is pretty important to a lot of people, and for very good reasons. I think the pandemic kind of just hammered home the point, just how important the healthcare system is. I kind of look at the healthcare system as akin, not quite, but akin to, the fire department. We need them to be available and accessible and ready to put out fires, at any point. So I want to go back to our panel members. Mike, I want to start with you. When you look at the satisfaction levels in this survey, can you validate them? Is that what you're seeing in your hospital system?
Well, so what I would say is, many people's perceptions of healthcare it's based on their experience or the experience of others that they've talked to. And I guess I would maybe say I'm a little bit biased, but I truly do believe that healthcare in general is very good in our state. Now, that doesn't mean that there aren't challenges, because there are, and there's always room for improvement, really in the areas of access to care, looking at the quantity and the type of physicians that we have available in our communities. And especially in rural settings, as you just saw, the 89% dissatisfied in Western Arizona for mental health. I mean, it is very challenging to get mental health coverage or providers here in Western Arizona. But overall, healthcare, I think, is very good in our state. We just need to continue to work on improving that and improving access to care. I think that's one of our biggest challenges.
You mentioned earlier just the difficulty of recruiting healthcare workers, especially to rural areas of the state. If you can talk a little bit about what's happening on that front and how are you counteracting it as well?
Yeah, so we're working hard to recruit physicians and nursing staff and other clinical staff that we need. We have several challenges here in Lake Havasu City, one being that the cost of housing and the availability of housing is really difficult. So trying to recruit, we had three individuals that accepted offers, not physicians, but just regular staff last week and turned us down because they couldn't find anywhere to live. So, I mean, that's a huge challenge for us here.
So they already said yes, and then they looked around and tried to get housing and could not get housing.
Correct. Yeah, they accepted the offer and then tried to find somewhere to live and couldn't find anywhere, and so had to turn the offer down. So that's a big challenge for us here. But we're working hard to recruit physicians. We have 9 new physicians that will have started between August of this year and last August. So that's pretty good for us. And really trying to build the primary care provider base, pediatric base up here in our community. So that's a huge focus for us. And then, of course, on the nursing staff and when you look at respiratory therapists and pharmacy techs and radiology techs and phlebotomists, all of those types of positions, it's a challenge right now to try and find those people, and then get them to move to a rural town is even a little more challenging.
So what's your elevator pitch? Let's say that Dr. Shah is in the elevator room with you and you have like a minute or less to convince him to move over to Lake Havasu. What would you tell him?
Yeah, so Lake Havasu it's a beautiful city, a beautiful community. We've got with the lake right here and all of the outdoor recreation activities that we have. And then the nice thing here, being in Havasu or in Mojave County, is your proximity to other cities. So you've got Phoenix is about 3 hours away. Vegas is 2.5. You can be to San Diego in 4.5, or LA in 4.5 hours. So a lot of proximity to larger cities, but you don't have to live in the big city. You come here and enjoy the recreation, the outdoor sporting and water sports and things like that. And it's a beautiful community.
And Dr. Shah.
Or you can come to Yuma in Somerton.
That's right, Dr. Shah. And I guess my question to you then is, first of all, what are your thoughts about this survey? But also, if somebody would try to convince you to go move to a rural area like Yuma or Havasu, what would you say? And in fact, what are you hearing from your colleagues as well who might be considering moving over to the rural parts of the state?
Well, I'm not sure you know this, but I have actually worked at Yuma Regional Medical Center for a really long time.
Is that right?
Oh yeah, I did. And I also worked at Western Arizona Regional Medical Center, Bullhead City for a while. I did not work in Valley View, which I know is under your purview. And yes, I know Lake Havasu as well. I love that you can take a Sea-Doo and go up and down the Colorado River. That's
Yep.
time-honored tradition down there. So I am aware actually of the healthcare environment and the challenges that these guys face in terms of doing their recruiting. If you're able to recruit so many, you're doing something right, because it's a challenging thing. And for my part, I love that part of the state. I think there's some really gorgeous things there, but I don't know if I'm ready to accept a job offer from Mike right now, but we'll talk about that a little later. As far as the challenges are concerned, yeah, 100%, very real. I mean, you see this if you work in healthcare, you understand intuitively that the results of that Gallup survey are I mean, they're spot on. I mean, it's not anything that would surprise any of us working in the healthcare field. Many challenges. It's a big system, a lot of moving parts in healthcare. People always ask, like, wow, what a complicated subject. But yes, so you're going to have challenges in many places. So we can dive more into that if you'd like.
And Carmen, what are you seeing in your healthcare system as well?
When it comes to barriers, I immediately think of underserved communities that are underinsured, and the complexity of the life stressors that they're also dealing with. And so that presents barriers to accessing healthcare too. So it might be transportation or navigating public transportation in the heat. It might be language barriers. It might be fear of, for the population we serve. There tends to be a fear of documentation getting captured and reported about people. So that is something that we're constantly trying to work against. But I think that the biggest barrier in my mind is definitely insurance and coverage and gaps within that. So you have a population of people that aren't eligible to receive Medicaid. Then you have people that are eligible but maybe make too much money and then can't afford their premiums, and there's these gaps, right? So for your audience, I would say, supporting anything that expands coverage and helps individuals with their premiums. We have some nice proposals from the federal level about tax credits for healthcare in the presidential budget. Right now, so the uninsurance rate in Arizona in 2013 was 17%. In 2013, we're sitting at 11% right now. So after Medicaid expansion, we only made about a 6-point difference in that. And Massachusetts, by comparison, their uninsured rate is around 3%. And so what a beautiful thing for that not to be a barrier and to be able to access healthcare. On the provider side, we're trying to tackle accessibility by just being very available. We've added walk-in appointments. We've gone into mobile services, so going out into the community, so you don't have to come to us. We'll be out there at your settings and in schools and churches and different places like that.
And this is I'm sorry, didn't to cut you off, but this is your response to the fact that transportation and navigating that system is maybe difficult for certain populations. And so rather than having them go to your centers, you're bringing the centers to them in the hopes of catching them in their communities.
Yeah, part of our strategy of trying to identify, what are those barriers? How can we tackle barriers like that and remove it as a barrier? So going to people is one of those ways. And expanding our hours. I think there's a beautiful model out nationally called Certified Behavioral Health Community Health Centers that really push for 24/7 availability of crisis services and counseling and intake. And so we are on a plan to really be available around the clock and just through a variety of angles, reduce barriers.
And Amanda, in your case, ma'am, you mentioned mental health and how you're seeing an increase in substance abuse or the opioid epidemic that we've been struggling with. That hasn't really gone away. I know the state has done a lot on that end, but that problem persists and it hasn't gone away. And that's on top of other behavioral health issues that you're seeing in your community. But talk to us about, the biggest barriers to accessing healthcare in your area and how you're responding to them.
Well, I think that transportation is one of the issues in all rural communities, and certainly we don't have a massive public system in our communities in Yuma, La Paz, or Mojave counties. We have a minimal transportation. The taxis have become so expensive that people cannot afford them anymore. A ride from San Luis to Yuma, only 20 miles, people have to pay $35, sometimes $50. That is incredible, out of range of a lot of the folks that are hardworking individuals. They need that transportation. But yeah, I think one of the things that we've seen tremendously affecting our children and our young adults, from children with special needs, with autism, during this pandemic, the isolation is exacerbating their problems in mental health issues. With the young adults, and we've been working with the probation department as people are being released from the jails to try to make them to get back to a system, create a safety net for them as well, so they can become productive citizens in our society. And that's a challenge itself. The housing that Mike spoke about is in the public housing is so limited that a lot of individuals end up in the streets again, being homeless, and sort of fall into the cracks as the system trying to reach them is very hard. So you have to work 10 times harder when you have the SMI population, out there with no support and trying to create that safety net, but yet housing is not available. We have a lot of the lack of food accessibility. So where do they go to get affordable, not only the healthcare, but food as well, so they sustain themselves. So it's like a vicious cycle. We talk about social determinants, and we're trying to tackle each one of those social determinants to be able to create that safety net. The opioid crisis is a tremendous challenge for all of us. I'm glad that the legislation, the governor signed those two bills, the two Senate bills that address the syringes uses and also the fentanyl strips that can be used now. It will become a crime if you get called by a federal agent, but nonetheless, that's a step in the right direction that will help us a little bit more on the opioid crisis. But we still, for example, we were just being approached by the Kingman School District and let us know that they have about 160 kids. They fall into the spectrum of autism with very little minimal services in the district. We were calling to assist with the school district in Lake Havasu to vaccinate children because they were so behind in immunizations. Every child that we vaccinated through the different helpers that we have helped, taking our mobile units and teams to those areas, came out with 4 or 5 shots in their arms. So that's how behind the system has gotten during COVID-19, and maybe even beyond that, because we saw some kids that have not been vaccinated for 4 years. And so you got a system that we got to strengthen and work all of us together, not just at the county level, but state level, federal level. The marketplace continues to be a place where we can enroll people in affordable health care. Hopefully everybody is promoting the marketplace, but it has this intonation about being Obamacare still. So some folks will say, no, I don't want Obamacare, but yeah, I like the marketplace. Well, it is the marketplace that you're getting enrolled. Let's do that, expanding Kids Care to children, increasing the income percentage of poverty level that can qualify for Kids Care, as was mentioned in one of the articles in Capital Times recently by, I think, was Representative Burns, I think. No, not Burns. I forgot her name. I'm sorry. But anyway, those are the kind of things that we need to continue looking to make sure that kids get enrolled in the healthcare and affordable. Many years ago, and I know that we want to get all the folks to talk, but we provided forming a structure of affordability of healthcare in Yuma County by establishing a network of physicians we call in the Community Access Program of Arizona, in which physicians agreed to provide services at all levels, primary and preventive. The hospital, Yuma Regional, was part of that, is part, continues to be a part of this. Diagnostic services provide a discount, 65% discount services for the folks that didn't have insurance. So you pay cash, and they arrange any payments arrangements with each individual. And the families were able to afford health care. And this is a small model project that we've done here in Yuma, and to make it access affordable. So if you end up in the hospital with a bill of $10,000, take off 65%, and that's what you have to pay only, without having to spend all your savings and mortgage your house and lose your house maybe, just to pay for a surgery. So it can be, we can reach that affordability that people are looking for. We just need to work together and have the will to do it.
And Dr. Shah, what are you seeing from the state in terms of response? You know, you've heard Mike talk about the acute shortage of healthcare workers. You know, that's happening across the state. It's more severe in rural areas, of course. You heard Carmen talk about some of the barriers in delivering healthcare and navigating a transportation system, but really the lack of insurance for many people. You know, you heard Amanda, try and respond to all these healthcare challenges in her community, and trying to create a program in which we can bring down the cost of care. In terms of state response, what are you seeing? And I guess more importantly, what do you want to see and what's feasible?
All of that is check. I mean, I agree with all of that. Like we talked about, lots of challenges. I want to kind of frame the discussion just a little bit. I have a master's in public health from California, Berkeley. This was a while ago. And the way in which we think about healthcare systems comes down to metrics. We try to ask ourselves on some of the key metrics, how are we doing? And those metrics are typically cost, quality, access, and then possibly choice. That's how we're taught to think about systems as a whole. Our system here in the United States does well in terms of choice. You certainly can go anywhere you want to go if you have the means to do so. In terms of quality, I actually think I think the world of my fellow healthcare workers in terms of the standard of care that we bring to medicine and to healthcare in comparison to, say, just the rest of the world generally. The challenges we have in the United States, in Arizona, have to do with the other two factors, which is cost of care. Cost is pretty high here. As you probably know, the United States spends twice as much as every other country as the next highest country on per capita healthcare. And that really just, it puts a lot of people, it puts it out of reach. Remember, we have a free market system with some patchwork, coverage in there, like Medicaid, like Medicare, like, the VA system, whatever. So we cover people through various things. It's that people, many people who are not in any of those things, even people who have private insurance, do face significant hurdles with regard to cost, because you have to consider that in relation to what somebody's income is, like the average income in America. And then finally, and then the last piece, the cost, and then the access, which are kind of tied together. The access piece, we still have 800, I think Carmen mentioned this, 800,000 Arizonans. These are real lives. These are real people's lives. And guess where they come when they don't have insurance and we need to take care of them? They come to the emergency department. So yes, in terms of anything we can do to lower costs, which will improve the access, and then things that will directly increase the access, which, no pun intended, might mean increasing eligibility for access, which is our Medicaid system. So all of that together are ways in which we try at the state legislature to try to bring better outcomes to people from a systems perspective. This is why the House Health and Human Services Committee is so active, and we hear so many bills every single year. So to touch on some of I know I'm going long, but just touch on some of these things as far as the recruitment, the I think Mike was talking about, and several others. You guys probably know that Senator Heather Carter from last session, the year before, ran a bill to increase GME funding. And so we could, and this was something I specifically supported because I know the challenges in Yuma and some of the other places in rural parts of the state where they're having trouble recruiting. If we can get homegrown professionals, then that really helps. One of my other big things is over the last couple of years is burnout. I've been working with the Arizona Medical Association, of which I'm a proud member, and we've been talking about legislation trying to reduce burnout. I had a whistleblower bill that was signed into law this year. I had a prior auth reform bill that was signed into law this year. So hopefully we're reducing the paperwork burden and administrative burden that also helps all the healthcare workers stay in place. And so we could talk about this for a long time. I don't want to chew up all the time, Luigi, but a lot of challenges, and we could go into every one of those, and I could say we are working on solutions for those.
And thank you for that. And Mike, from your end, if you look at what is and it's kind of to a certain level, it's kind of a dumb question to ask, but I'm going to ask it anyway, which is, what is the one thing in your mind that the state can do right now to really help out Havasu Regional Medical Center? What is the one policy decision that the state can enact, that the governor can sign to help out your hospital system?
Well, I would say, first of all, want to thank the state legislator and the governor for signing the expansion of Medicaid years ago, as well as the increase in Medicaid reimbursement this last year. That honestly, the timing couldn't have been better with COVID and what the hospitals were going through to have that rate increase go through. And a lot of it's funded through the hospitals and the provider fee that we pay and the federal match. So it didn't really cost the state anything, but it still opened that door to be able to get more funds into the healthcare system here. But I would say, looking at access and any way they can expand that care, I agree that it covers the lower portion, but there is that gap of people that don't qualify for Medicaid, but still can't afford, to have health care. And then from pushing also on the national level, from pressure from the state, I think can help on the marketplace, as Amanda talked about, and expanding that the marketplace, so the Affordable Care Act, so that more people can qualify or get discounts on their premiums and get more people into that marketplace, I think would be a huge thing. I mean, we talk about cost, and cost is a problem, in healthcare, period. And there are so many factors that go into that. I like to point out that hospitals are sometimes the bad guy in the end, because we get to give the bill to the insurance company or to the patient. But when you look at all of the inputs, the cost of the inputs that go into it, labor is our biggest expense. And when you look at healthcare labor, and it's expensive, and it's getting more and more expensive as the scarcity of resources of people are out there, it costs us more money. When you look at pharmaceuticals and you look at medical supplies and all of those inputs that come into a healthcare system, access, people expect an emergency room to be staffed 24/7. So we have to pay physicians to be on call and available in case somebody does come in the middle of the night. All of that costs a lot of money. And so, we have to look at that. The other issue too, when we look at where we spend the most money, it's in those last few years of life. And so I know the Arizona Hospital Association has had an initiative called Thoughtful Life Conversations to try and educate people on what choices do they really want to make. If they choose to have everything done, and when they're in the hospital and they're 90 years old, and they want everything done, we can do that. But here are the outcomes, and here's a likely scenario of what your life will be like for the last, year or two. We can extend your life for that 6 months or 12 months. And here's what it will look like, versus if you choose not to have as much done, you can have this level of quality of life for, 2 or 3 months. So we've got to educate people more in that the end of their life, for what they really want done, if we want to really bend the cost curve in healthcare.
It's such a tough and difficult question that you raised, which is you're 90 years old and you have chronic illnesses. You're, back to the hospital pretty regularly. And the question is then posed, what array of services do you still want to get at this point? And I guess that's one of the reasons why healthcare, our healthcare system is so costly. It's very hard to put a premium on life and life expectancy and how long do you want to live, and the uncertainty surrounding all those areas. Carmen, I think you mentioned really the underinsured, and we talked about expanding access, which is the Arizona healthcare cost containment system, our state Medicaid system, and catching those folks, and just giving them the opportunity to afford health insurance would solve a whole lot of problems. Absent that, what is your organization, what is doing at this point to still provide care to those folks that are in this gap?
Thank you. Well, as a health center, we have to see everyone regardless of the ability to pay. So we do, from a preventative care and behavioral health care, standpoint, can see people that come to our doors. Where it becomes unaffordable is those surgeries or that, expensive cancer treatment and pharmacy costs. I think when we think of solutions, thinking of Representative Shah, said for your audience, support student loan repayment, GME funding, support pharmacy coverage. At the federal level, the American Families Plan is really looking at tackling pharmacy costs. I think that would make a big impact. And I'm really thankful to our state for passing the support on mental health parity that really, is creating commercial plans to recognize and deliver, parity when it comes to mental health. And the other area we haven't touched on is telehealth. The expansion that we did in telehealth at the state is so impactful. I'm so grateful for it. And I think it's really going to create a lot of availability for specialists and, to be seeing people in rural communities. An example I have is, we serve a lot of children in foster care that might get moved around within the county, out of the county, in temporary placements to, stay with a grandparent for 6 months or something. Their care is not disrupted, thanks to systems that, we can connect now virtually through telehealth. And so just wanted to touch on that point.
Yeah, hey, Carmen, that's a great point as well on the telehealth. And one of the areas in rural Arizona too that we need to look at and that the state can help with is the broadband access and infrastructure there. So, I mean, that would be another area that the state legislature could help out, is to try and build up that broadband infrastructure, which will help on the telehealth side.
Right, because in order to have telehealth, you need to have a computer system, you need to have Wi-Fi, which means you really need to have the infrastructure in place so you can access telemedicine. I want to go to some of our audience questions. There's quite a few of them. This one is for Representative Shah. You've just laid out the picture of our broken healthcare system. This is according to Linda. I'd like to know how you feel about universal healthcare.
Thanks. For the question. I've ever since I've been running or been in campaigning or in the political world, I've talked about the need for universal coverage. If you look at other countries across the world, they do it. And they, more importantly, what's getting lost. I mean, we talk about the costs of all this. Well, how much will it cost? How much? We don't seem to want to talk about the biggest gain, which is the efficiency of the system. When things become a lot more efficient because of these kinds of systems, you actually do reduce the costs as well. That's part of why this is such an important thing. Whenever we do things like this, if they're as you saw from the Gallup poll, these things are very, very broadly popular things to do, because once these things actually get into place and people realize, oh, wait a minute, we're not going bankrupt anymore because of healthcare bills. I mean, I'm not going to receive a multi-$1,000 bill just because I went to the hospital, I got sick through no fault of my own. Even if I had private insurance or I tried to do the right thing and I just had a massive deductible plan or a massive copay plan, et cetera, et cetera. So yes, the short answer is basically yes. We have to have some way in which we cover everybody at the basic vanilla level, and that allows for everybody to feel a level of security. I also think it has broader implications for the labor market and everything else, to really help our economy overall, and not spend so much of our GDP as a whole on just one sector, which is healthcare. So broadly, yes.
Thank you. I think this is a question that maybe Carmen can answer. Can you speak to the special enrollment period for the Affordable Care Act? And this is from Jana, and Jana is saying that it's open until the special enrollment period is open until August 15, and impact through access to healthcare through Medicaid and the marketplace.
Yes, it is open right now, and you know, it's about promoting it and educating people about accessing it. There are enrollment specialists that are, you know, certified and placed in community settings. So I think it's healthcare.gov that you go to find where your local enrollment specialist is. One other point that, in a question that you made, Luigi, right now the state is considering a response to the American Response Plan funding would be an expansion to access for home and community-based services. That would be a temporary increase to the federal match for 10% increase for 1 year, and we could spend it up to 3 years. So that is an opportunity and area of research for your audience, and you know, a temporary way to inject dollars into the healthcare system as we try to overcome all these barriers that we're facing.
And I guess I think we have room for just one more question. This is from Leonard. Amanda, do you have a sense as to what percent of the undocumented residents in Yuma are vaccinated or unvaccinated?
Since we're not requiring immigration status when we vaccinate, we want everybody vaccinated to prevent COVID-19 being spread out. I don't have a percentage because we just don't ask for immigration status. We're glad to vaccinate everybody.
Perfect.
But I'll tell you what, we've been working with Homeland Security and FEMA and a lot in the Biden administration and Senator Kelly's office, and in addressing the migrant situation the search of migrants coming across the border. And we had set up camps where we are testing the migrants coming across the border, and the number that we're seeing, they got positive, is less than 1%. If that makes them a little bit an idea of what the migrant situation that we're dealing with as they're coming in as refugees into this country is less than 1%.
And thank you for that. And I think that's a good place to end this discussion. I want to thank Mike again for joining us this morning. Amanda, thank you. Carmen, thank you. Representative Shah, thank you for your time this morning and for being so generous. I want to thank again the Center for the Future of Arizona for sponsoring this morning's scoop. And I guess with that, I'll say enjoy the rest of your day, have fun, and I'll see you around.
Thanks, Luigi.
Thank you.
Good to see everybody. Thank you.
And with that, bye for now.